Okay, so my name is Reverend Sister Antonia Oji. I am with Achoribo Foundation, and today we are doing the breast screening cancer. Since we are in the month of October, we see that this is a healthy opportunity to talk to the young ones, the teachers about breast cancer. We have gone through the education, the examination of it is ongoing. And it's so amazing to see the young girls in this part of the world willing to be screened and have questions to know more about breast cancer and in our world today. So ongoing screening is successful, is going on. And we are happy that the teachers are also taking part of this screening. They are not taking themselves away from it. They are coming in. And after the education, we have observed that some are having like a skin tag, which they are not sure what it is, or they are using a local way of trying to take care of it. So we are also able to educate them about the need to take care of it, and at the same time, most especially to report to the hospital when any abnormality is seen, instead of having a home care treatment or instead of trying to use some home remedy treatment. We're also trying to conscientize them, to tell them that there is need to go through the medical screening instead of having a self-care or thinking a means of prayer could solve it. So our mission here is ongoing, and we are hoping to touch more people in this community and to create the awareness for people to know that breast cancer is real. It can also be treated. Early detection is the way forward. And this is a beautiful thing the Achoribo Foundation is doing today.
So on the part of the parents, I think parents must be very deliberate about the health of their children. Most of the time we socialize the children on a lot of things, but we always forget about the health aspect. Something as common as hand washing is mostly even neglected in the homes. So I think these very little practices, personal hygiene, hand washing, and all these little health practices that we've known over the years, we must always revisit them again. It will help the children a lot. On the aspect of the schools, I think it is about time we introduce health studies in the curriculum and also on the timetables, that we must have dedicated time for health studies, where even if the teachers cannot do it themselves, they invite health professionals to come and educate the children, just like we have come here today. But for the fact that we wrote to them to come and do this activity, I don't think it would have been done. But if the ministry can help us and also dedicate a particular time or have it as part of the curriculum, that we take common diseases and disorders in the community and we educate the children about them, I think it will help us a lot. Some of the challenges that we face is that sometimes getting the schools to come on board is very difficult due to the busy nature of the curriculum. So sometimes making time for activities like this has become very challenging. So we are entreating all schools, we are entreating all educational facilities to see the importance, to prioritize activities like this, especially when it comes at no cost to the school. I think we have to prioritize them, and when the time comes, we should make time for NGOs and foundations like this to come and talk to the children about their health, because these are things that are with them, things that we, even if we know, we need to revisit them from time to time to help us. Today we are talking about breast cancer, and we know that early detection helps. So even if we have heard about breast cancer before, we need to still let you know that it is still with us, and we have to do the basic things to always make sure that we detect it early so that the appropriate help
Some of
can
the
be
things
given.
I've learned from this lesson is that boys also get breast cancer, but it comes through blood. If blood comes from your nipple, either blood or water, but you should always report to the hospital early to get a better treatment for the breast. And also alcohol and drugs also produce affects the breast. that causes breast cancer. And it's not only breast cancer, but also different other infections. So we should take care of our body. Always go to the hospital regularly. Through the education, either blood comes out from the breast or water. The nipple becomes swollen. The nipple becomes swollen. And then breast loses weight. Like it becomes big. And then it starts to become small and becomes big again. So when we see these signs, we should always report to the hospital early so that we'll get a better treatment for the breast. We should all protect ourselves and make sure that if any of these signs come on your breast, we should all report to the hospital or go to a teacher who knows more of it.
The NGO came to Saduase JHS to demonstrate to us how to know whether we have breast cancer. So if you want to know, first of all, you put your hand here, you use your forehand finger like this on top here, you put it on top of your breast from the armpits. You press it small. You'll be moving your hands small. So you do it to the top, from the top to the down. So when you get to your nipple, you check. There you have to press it to see whether you have a kind of maybe some water. They have some water there. So if the water comes out, use your tissue to clean it and check the kind of water that you have. When you go to the hospital, you can send it to the hospital or the doctor will check it and know whether you have the breast cancer. So my friends and sisters, you have to learn more about breast cancer so that you will stay away from.
I learned that breast cancer is an abnormal growth of cells in one's breast. And some of the causes of breast cancer include taking of sugary foods, not exercising regularly, taking of alcohol, smoking, and a whole lot of things. And we're also told by the NGOs that some of the things we need to do to prevent breast cancer is to, one, we can always exercise regularly, not like it should be about 20 to 30 minutes. Sometimes when we wake up and we are sweeping, we are walking, there are all forms of exercises that can reduce the risk of breast cancer. And also, we must avoid taking too much sugary foods. We must eat balanced diets with the 4-star minerals in the food like protein, carbohydrates, fat and oil and vitamins. And it's not only women who have breast cancer, men can also get breast cancer. And another prevention method is when a woman gives birth and she's breastfeeding the child, the estrogen in women goes to sleep and something in the breast also comes again, which helps the women's risk of getting breast cancer reduce. You can also visit the hospital twice in a year, and you can also practice the breast methods like the wedge method, the line method, the circles method. So like you can always check them after like 3 to 4 days after menstruating. And yeah. And when you notice any abnormal signs in the breast, like sometimes your nipple going inside what's supposed to be outside, sometimes one of the breasts will be bigger than one, you can visit any nearest hospital to ask them about it.